Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP's cable television channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so glad you could join us today for my number one special guest, Dr. Sohrab Gollogy. Dr. Gollogy, thank you very much for being here.
Thank you for inviting me, David.
Dr. Gollogy, I want to go over some of your training and what you're doing now before we get on to this exciting topic of operating in Cambodia. So tell me, Dr. Gollogy, you are board-certified in
orthopedics and spine surgery.
Okay, so you're board certified in orthopedic surgery. So you guys take care of the bones and the joints, and you're also a spine surgeon, correct?
Correct.
Now, I understand you've done some fellowships.
I have. After I finished my medical school at the University of Washington, I went to the University of Utah for 5 years of orthopedic residency. I then went to France for a year of adult spinal deformity surgery in Lyon, which is the capital of French cuisine. And then I went to San Diego and did a year of pediatric spinal surgery.
Dr. Gollogy, now for patients who are interested in understanding the difference between residency and a fellowship, how do you explain that to them?
Fellowship is an extra year or two of specialty training on top of already a specialized career. And typically what it does, it gives you the opportunity to spend a lot of face-to-face time with a professor who is a nationally or internationally known expert in a particular field. It's at a time in your career when you're licensed to practice orthopedic surgery and you could go out and hang up a shingle or join an academic faculty somewhere. But it gives you the opportunity to perhaps explore in a much greater depth than you would do during normal training some very, very specialized facets of the area of surgery that we all perform. And as medicine and surgery in general has gotten much more complicated, it's much more common now for people to do fellowships on top of already lengthy 7, 8, and 9-year residency programs in order to become super subspecialized in what they do.
Okay, so when we finish medical school, we get the MD, the medical doctor title, the diploma. And after you finish your residency, and you did 5 years of orthopedic residency, so you're eligible to go out and work as a orthopedic surgeon. And
Correct.
You could have,
Correct.
But then you elected to do 2 additional years to specialize in the spine.
Correct.
And your fellowships, did you say, were in Lyon and San Diego?
San Diego Children's Hospital.
How did you like France?
I loved it. I had always had a childhood dream of living in France or studying there, and in some respects that satisfied that from a lifelong perspective. I certainly have no desire to go back and practice in France. It's a much easier medical community to practice in the United States. The medical community in France is very hierarchical, but it's also been over the years the site of a lot of great learning.
Right.
And there are some very, very famous and fabulous professors whose quality of life and academic affiliations allow them to do things that can't be done in the United States because they're not bothered with the burden of paperwork and academic appointments that occur in the United States.
Well, there's some very interesting and exciting things going on in Lyon in plastic surgery, my specialty as well. They did some face transplants, etc.
Yeah, so France, paradoxically, is one of those, from the medical perspective, is a unique place of some striking innovation in the hands of certain people. And then for people who practice in the system, sometimes it can be a dead end where they can have no opportunity to develop similar opportunities for themselves. It's not a true free enterprise system like we have in the United States.
Dr. Gollogy, so tell us what you're doing now. You practice here in Monterey.
I do. I practice now in Monterey, California. I'm in private practice. This is the only place that I've worked since I got out of residency. I'm in private practice with 4 other doctors. My partners, Dr. Christopher Meckel, Dragan Dimitrov, Gary Chang, Lori Kleinman, and now our new upper extremity surgeon, Jimmy Lin. All specialize in particular areas of the body, but we all practice primarily musculoskeletal medicine. I'm starting to narrow my practice down to the point where I do only spine and hip surgery. Most of my patients who come in to see me have some complaints of pain in the region of the spine and the hip, and teasing those out are often a diagnostic dilemma. And as a result of the fact that I have to take trauma call at community hospital, I still do a lot of hip fracture surgery. So I've elected to maintain, develop, and oftentimes even foster an academic interest in the hip as well. And my partner, Dr. Meckel, and I recently started doing minimally invasive direct anterior total hip arthroplasty in 2006, which we believe is a substantial improvement over some existing forms of hip surgery. So we've been very satisfied with that. So now that I've been in practice for about 6 years, I'm getting to the point where I'm starting to be busy enough that I'm getting even more specialized.
Good. So that's Monterey Spine. Monterey
Correct.
Spine and Joint, is it?
Correct.
MontereySpineandJoint.com. Well, Sohrab, before we talk about Cambodia, or actually it's a great segue to talk about Cambodia, tell us about your dad. He's a very interesting gentleman that I hope to meet sometime soon.
We'll have to get him on your program. You would enjoy having him as a guest.
I'm sure.
He is a European-trained orthopedic surgeon, trained at the at Dublin University, Trinity University in Dublin, and for the last 15 years has been running a charity hospital in Cambodia. It's a hospital that he started, that he raises all the money for, and that does surgery free of charge for people in Cambodia who cannot afford to pay. So he's elected to basically leave the Western practice of medicine behind, and instead he's almost reinvented himself as a third world disability surgeon. And what that means is that the burden of disease in a place like Cambodia is so fundamentally different than that of the United States that you need to learn an entirely new subset of skills and operations and be comfortable with an entirely different subset of diagnoses than what we run into in the United States.
So he trained in Dublin.
He did.
At Trinity Hospital in Dublin.
Yep.
And he's been in Cambodia for the past 15 years?
15 years, correct.
And he has his own hospital, essentially.
He does. He has a hospital that does about 4,000 operations a year, which is about equivalent to what we do in the main OR at Community Hospital. So it's a pretty extraordinary body of work on a year in, year out basis. Now, he doesn't do all those operations. He's not a madman. He has a residency training program for Cambodians. In Cambodia, if you graduate from the medical school system in Cambodia, there are not anywhere near the same number of opportunities that there are in the United States for postgraduate medical education and things like residency and fellowships. So what he does is he has a hospital and he employs Cambodian licensed surgeons and then brings in people like you and like me 1 or 2 weeks a year, generally the same time every single year, and we would have the opportunity to teach those people some of the things that we've learned in our careers in the United States, and they oftentimes have the opportunity to teach us many things that we never knew anything about.
Well, that's amazing. As many of my viewers and listeners know, I go somewhere to some developing country to do cleft lips and palates each year. The Rotary Club sends me somewhere, and it's very rewarding. Great to help kids, as you know.
Yeah.
So you got back from Cambodia when?
2 weeks ago.
And how long were you in Cambodia?
I typically go twice a year, once or twice a year, and normally I go for between 1 and 2 weeks. This year I went for 2 weeks, and I was accompanied by one of the general surgeons from our hospital, Dr. Mark Vieira, who also has an interest, as you know, in third world medicine, who was an absolutely fabulous person to have along as a colleague, as a co-surgeon, and as a travel partner.
That's so great. So, Sohrab, so you fly over there. How long does it take to get to the hospital?
It's San Francisco to Taipei is 13 hours. Then it's about 3 hours on the ground in Taipei. It's another 4 hours in Phnom Penh, 4 hours to Phnom Penh from Taipei, and about an hour drive. So it's a 24-hour flight, and it's a 13 to 14-hour time change, depending upon whether or not there's daylight savings times in the U.S.
The more experienced I get operating in third world countries, some of the toughest part is the travel to get to where we're actually going to do the operations, right?
If you were to take a map of the globe and put one finger on one side and one finger on the other, they would be exactly equidistant apart if you were to put your finger on Cambodia. So you literally do have to go to the other side of the world. It's an amazing fact that in 2010 you can get on a jet and less than 24 hours later you can be on the other side of the world and be somewhat rested enough to perform surgery.
Well, it is amazing. So, Dr. Gollogy, tell me about some of the cases that you actually did at the hospital.
Well, my role in that organization has been to teach some aspects of orthopedics. So technologically appropriate forms of orthopedic care in Cambodia, which is probably not that similar to the practice of orthopedics in the United States. Other people like you, if you were to establish a relationship with my father's hospital, would go and teach cleft lips and cleft palates. So the hospital does many, many different things, and I only do a very small portion of that. So there are a few surgeons that I work with every year, and in 2006, I did the first spine surgery in Cambodia that utilized instrumentation.
So teach me about that. What do you mean utilizes instrumentation for spine surgery? What's that mean?
So in this case, what it meant was correcting the scoliosis of children with very, very severe spinal deformities. So prior to that, that form of surgical intervention simply was not available in Cambodia. No one had ever corrected a scoliosis before.
Now, when you say instrumentation, do you mean you put in implants to correct the spinal curvature?
Correct.
And you leave them there?
We do. So what we do is we use a combination of titanium special screws called pedicle screws and titanium fixation rods to grasp the tops and the bottoms of a curved portion of the spine and then derotate and straighten out that curved portion of the spine to make it closer to normal and to facilitate fusion across those levels. And that's called a spinal instrumentation with fusion for scoliosis. And that's a common procedure that's done in the United States, typically in adolescents with a bad curve. In Cambodia, what happens is those curves are typically neglected for a much longer period of time, and so when we get to fixing those problems, they're typically much worse, they're harder to correct, and as you know from being in a third world country, the pathology and the diseases that you see are often much more severe.
That is amazing. So most of the cases you took on were more severe than you would see in this country?
I think you would find the same.
Okay. So you did spinal surgery there. Did
Correct.
you do any hip surgery?
I
you
did.
do any
So,
trauma? Or?
In concert with my specialty interest here in the United States, I also concurrently developed a hip program. So I took over some hip prostheses from the United States that were donated by a company called Stryker, and in 2006 did the first ever hip replacement surgery in the country of Cambodia. Now there we're operating typically on patients in their 20s and their 30s, whereas here we're operating on patients in their 50s, 60s, and 70s.
Well, why would a patient in Cambodia who's 20 or 30 years old need a hip replacement?
Yeah, for the most amazing reasons. So these people will fall, it's an agricultural subsistence economy, and so they'll fall from a tree while collecting dates or mangoes. It's a country that floods every year, so the houses are often built on stilts, so many of the orthopedic injuries involve falls from heights. In the United States, if you fall from a height and you dislocate your hip, you'll go to an emergency department, someone will take an x-ray and they'll put the hip back in the socket, and it won't be a problem for you. Maybe you'll have a little bit of a limp, but a minor one at that. In Cambodia, if you dislocate your hip, what happens is the local village healer takes a hot coal out of the fireplace and puts it on the area that hurts. And when he takes the coal away, it feels a lot better. And that's called traditional Khmer medicine. And so the dislocated hip is often not put back in the joint. And so as a result, the head often dies, or they get a hip contracture and a limb length inequality, and they develop a permanent limp and permanent disability. So that's a disease of the hip that is unseen in the United States now. We see it in immigrants that come from other countries, but essentially is unseen in someone that lives in the US. So the surgical solution to that is to actually replace the hip joint with a new prosthetic one. And so after the first forays in using implants from the United States and taking them all the way over there and having a lot of problems with customs and taking expensive instruments into another country, what we started doing was importing components from India that are made by a very entrepreneurial Indian manufacturing firm that is probably making the equivalent of ripped-off DVDs, but in this case for total hip arthroplasties.
Knockoffs.
Knockoffs, and I can get a knockoff total hip in delivered to Cambodia for $200, whereas the same implant in the United States might be $5,000. So that gives us the ability to do technologically appropriate surgery in Cambodia, because the goal is not for me to go over and do a number of operations. The goal is for me to go over and teach somebody else how to do something similar. And that's at a price that that economy can sustain. So someone now can come to Cambodia and see one of the surgeons that I've trained, and that surgeon can make arrangements for India to send them a hip that the patient can pay for. They can pay the surgeon to put in the operation, and they can get it done at a cost that's feasible to them.
Well, that's amazing. So you did the first total hip arthroplasty in the country of Cambodia.
Correct.
In 2006.
2006.
Well, that's an accomplishment in and of itself.
It is.
And then you did the first spinal instrumentation surgery.
Same year.
Well, it sounds like you're following in your dad's footsteps, Dr. Gollogy. It's so exciting.
Somewhat.
What a legacy to stand by and to live for. That's amazing. So I've got a question about healthcare in general in Cambodia. And, you know, I wish we could go on and we could talk for hours. But you said the hospital's free for people there, or they have to pay, or how's that work?
The hospital my father runs is a charity hospital. So the money is raised from private donors, and then all of the surgery is provided free of charge. They do no needs testing, and they assume that everyone that shows up can't afford to pay. There are private pay options in Cambodia, but there is essentially no public free of charge system of caring for people. And as a consequence, many disease conditions that would be easily managed in the United States or in a system with a more advanced form of healthcare are neglected in Cambodia because people simply either cannot afford to pay or there is no one with that particular skill set. in the country.
Now, when you go there, are you welcomed? Is it difficult for them to honor your license? Are you treated well? Do you feel like you're an outsider? What's sort of like the social, political atmosphere when you go there to operate?
Cambodia is reinventing itself. It went through the largest auto-genocide in human recorded history within the last 20 years.
That's with the Khmer Rouge.
The Khmer Rouge and Pol Pot, and most people are familiar with that with the Western view from The Killing Fields, which is the movie that was made about the photojournalist that went missing. But now Cambodia is emerging, and it is a bright, vibrant country of 12 million people where 50% of the people are under the age of 12, so it's very, very young. It's had an enormous spurt in growth after...
50% of the people in Cambodia are under the age of 12.
Yeah, so you've never seen so many kids going to school in your entire life.
Wow.
So you would feel extraordinarily welcome from a social perspective. It's a Buddhist country. They are very, very welcoming and accepting of foreigners. There's no hostility whatsoever towards America. They love the internet. They love Kentucky Fried Chicken. They want their hands on anything that has anything to do with America. The licensing is a completely separate issue. You know, you can't simply go to a third world country and practice medicine, but my father has a memorandum of understanding with the Cambodian healthcare ministry. Your CV would be forwarded in advance. You would have a provisional license to operate there. But every operation that you would do in Cambodia, you would be essentially playing the role of a teaching assistant to a Cambodian surgeon. Okay. So you're not going to be the primary person operating, but you'll certainly be helping someone who is.
Dr. Gollogy, sounds great. You know, it makes me want to go. I'd love to sign up and go and meet your father. Sounds like a great guy. What a legacy to follow. Two quick questions, because we only have about 30 more seconds. How do people, if they're interested in your practice or want to see you about something, how do they get a hold of you?
You can call my office. My office number is 648-7200 if you want to come and see me about problems with your spine or your hip. I have a website, www.sohrabgolloglymd.com.
Okay, now I better spell that for people. So first of all, it's 648-7200.
Correct.
And Sohrab is S-O-H-R-A-B.
Yep.
Gollogy is G-O-L-L-O-G-L-Y.
Yep.
.com. Excellent. Now, one other thing, 10 seconds. I heard there was a television program or a special about you and your dad?
There was. An independent film crew from the BBC from Hong Kong came and made an hour-long documentary that aired on PBS in the United States, and it's called Cambodia OR. And they likened the two of us to the father and son team on Orange County Choppers, which is a motorcycle rebuilding program. And I think they enjoyed the personality, and the documentary's out on public television in the United States.
I'd love to see that, and I'd love to go on talking. Why don't you come on the program again?
I'd love to,
It'd be great to have you. Sohrab Gollogy, MD, board-certified orthopedic surgeon. Thanks for coming on the program.
Thank you for your time.
I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to come right back after a very brief pause for a very good cause. Thanks so much for being here.